Hello and welcome to the Love Mia Vita podcast, sponsored by Fem Pharma. I'm Jerry DiPiano, founder and CEO. Thank you for joining us as we discuss all aspects of women's healthcare. Please note, this podcast is for educational purposes only. Always refer to your healthcare practitioner for personal advice. I'm here today with Dr. Maria Sophocles, and we're going to give you a preview of Coming Attractions, which is a book that FemPharm is going to be launching called Positively Sexy. And as the name would suggest, this is about different ways in which to enrich your sex life. It is something that women of all age can benefit from. And here we have one of our chapter authors, Dr. Sophocles, who is a board-certified OBGYN, a member of the Medical Advisory Council for Fem Pharma, and so much more. So, Maria, a little bit more about your background.
Okay, but first, I love your leather jacket, Jerry. It is
Thank you.
so chic. You look
Thank
great.
you.
I just had to share that. My background, I'm a 30-year board certified OBGYN. I'm a woodworker, a mother of four, and a fierce advocate for closing the gendered healthcare gap. My TED Talk addressed what happens to sex in midlife, and my book, The Bedroom Gap, which is out February 10th, addresses what happens and what are the forces that shape that. And one of the things we talk about is orgasm and the orgasm gap and all the different kinds of orgasm gaps out there. So I thought it'd be fun to dig into that with you today because that's part of the book,
That's why
of
I'm
my
wearing my
book
black
and your book.
leather.
Yeah. Yeah.
I'm
All
wearing my
right.
black leather to support somebody that I brought with me. I have a little guest today. Her name is
Ooh,
Mia V. And
nice.
she is the clitoris.
Nice. And there
So
she
Mia
is.
V, she is like the powerhouse of a female's body. So let's talk about the biology of climax first off, and the powerhouse, Ms. Mia V, the clitoris.
Well, put Mia V back in there because I think we should start with the anatomy. So I
Okay.
think of the clitoris like an iceberg. You see a little bitty tip above the water, but there's this enormous structure under the water. And the clitoris is the same. If you turn it sideways, Jerry, you can see it actually angles almost like a penguin's beak or something. And the little nub is the only part that most humans ever see. That's what is at the top, the apex of the opening of the vagina. It's covered by a hood.
She's getting
Uh,
excited.
yeah, it's covered by a hood. The labia minora make almost like an archway and kind of end up near the clitoris. But there's this enormous structure inside. The full size of the organ is maybe 4 inches long. And then it has a pair of bulbs. You can see these sort of thicker areas. And these are, right, and thousands of nerve endings. It's actually much more like male anatomy than one would think. Remember, there's not just a penis and a shaft, even though that's all external, there's also internal organs for men and the testes and scrotum outside. But for women, all of this is inside except for the very tip. But don't let that tiny little bit fool you. The nerve endings, the density of the nerve endings of the clitoris, it's the most nerve endings per square millimeter in the entire human body, male or female, even more than a penis, even more than around our mouth, even more than around our eyes, and all these delicate little places. Sadly, this information is actually new. We've known about the penis for thousands of years. Leonardo da Vinci, and Michelangelo, people dissected penises. They drew them, they sculpted them, they've glorified them. But female external genitalia has always been just some little V-shaped wedge that everybody prefers not to look at or know about. Now, I'm so glad you and I are going to change that. So we want to
Our
remember
mascot. It's our
our
mascot.
mascot, Mia, has
Mia. Mia V.
thousands, Mia V's got
Mia
thousands
V.
of nerve endings, and they are extremely responsive and sensitive. But With age, as we lose both estrogen and testosterone, those nerve endings become less sensitive. Also, the blood vessels around the clitoris that are very much a part of orgasmic response, they decrease. If you watch my TED Talk, there's a little clip that shows what happens to female genitalia when we take estrogen away and why it's so hard to maintain moisture and have comfortable sex. And this applies to the clitoris too. When you lose the sensitivity of nerve endings and when we lose blood flow, we cannot have the same orgasmic potential. So we sort of fade off into, we may resent it, we may be frustrated, but most women just accept, I guess this is the way it is. And that's frustrating because it is something that if you talk to a doctor about, you can sometimes get help with. Sometimes there are medical reasons for that. So I'm telling you about menopausal reasons. But guess what? Clitoral health and the ability to orgasm is actually related to your cardiovascular health. So when your blood vessels get cholesterol or they're diabetic and they don't have the resiliency and the elasticity that they used to, believe it or not, that affects a man's ability to have an erection and an orgasm and a woman's ability to have an orgasm. So don't be afraid to ask and don't be ashamed to ask your primary care, hey, is my diabetes in control? Is my glucose in control? Is my cholesterol okay? These things have sexual health and orgasm effects. So I think the anatomy is a good place to start. Um,
Makes
r-
sense. And I love the, reminder to please check in with your primary care or with whomever, your practitioner, your healthcare practitioner, because
Mhm.
we know that these underlying conditions can have an impact. I mean, this is a very vascular area of our body. So
Extremely.
with the vascularity, with the abundance of nerves, if you have diabetes and you have some sort of neuropathy, tingling in your toes and feet, and you can't have an orgasm, perhaps
Could
it's
be
related.
related. Right. Same
That's
with heart disease. If you had high cholesterol and you had a heart attack or you had a stent or a bypass, don't think for a second that your genitals aren't affected by that. We know that you can put topical estrogen on the inside in the vagina and even externally and promote development of blood vessels, which is promising. Um, I think it's important for people to understand that the clitoris actually swells and engorges, and so do the labia minora. Remember, there are two sets of lips, the big kind of puffy, almost fatty lips, the labia majora, and then these slender, thin labia that are sort of the doorways that keep the entrance closed to the vagina. The labia minora are what are often resected to when women want labiaplasty. And I bring this up as a side gig, a side comment, because it can affect sexual performance. The labia minora are involved in sexual response, just like the clitoris is. They swell and engorge, and good blood flow is needed for the labia minora also. So when you go through menopause or age or of diabetes or heart disease, you can affect the labia minora also. But cosmetic genital surgery can also negatively impact the labia minora, and the nerve supply to the clitoris can be inadvertently cut and impact your ability to orgasm. So do not for a second think that having that cosmetic labiaplasty is just a snip, snip, and I'm good. I look more like what I wanted to look like, or I'm more even, or whatever. I'm not saying don't do it, but you want to know that the surgeon really is experienced because they can harm you. There can be sexual fallout that cannot be reversed from that. So I just had to give a little safety plug there, Jerry,
Well, I
about that.
appreciate that. Can we talk a little bit about the pelvic floor?
Absolutely. The pelvic floor doesn't really get enough attention because people say, well, I want vaginal moisture, I need lube, I need hyaluronic acid products. And that's all true. We want moisture to have comfortable sex. But if you've had uncomfortable sex, you may develop something called vaginismus, where we have this involuntary kind of clenching of the pelvic floor. And until that gets reversed and undone, it's hard to have comfortable sex. I also think it's important to note that the pelvic floor is part of the orgasmic response. There are these sort of hammock-like muscles that support your bladder, your bowel, your uterus. And when you're aroused, one of them, the pubococcygeus, I just call it the PC because it's a big long word, which wraps kind of around the vagina, contracts rhythmically. So there are actually these rhythmic contractions as you're getting to really, really significant arousal. Now, if you have hypotonic muscles, if they're weak, whether that's from aging, childbirth, injury, or lack of use, lots of reasons they could be weak, or overly tight, or you have a pain syndrome, pelvic pain, in which they're not going to function properly. Those beautiful rhythmic contractions that are part of the orgasmic response can be muted or even not happen at all. And this can deprive some women of actually reaching climax or experiencing the pleasure that maybe they used to experience. I would say if you feel orgasm is different and you feel you have a clinician or even a therapist or a sex therapist that you could talk to, mention this, and they may refer you to a special kind of physical therapist called a pelvic floor physical therapist. These are only women, and they work beautifully to help restore the integrity of the muscle tone and help you isolate what's right and what's wrong. I'm so glad you mentioned that, Jerry.
And we know that they have special credentials. So it's not like you're going to the physical therapist that helps you if you've had knee surgery or hip
No.
surgery. They might be the same person, but oftentimes they are not. And be sure that you look for that special credential because they do receive very, very specific and detailed training and then certification as a pelvic floor physical therapist. Important for you to know that.
And we could link the website for the national organization of them so people could find one. And if
Yes.
nothing else, you can go to the National Organization for Physical Therapists and then search pelvic floor physical therapists.
Yes.
So, but you're very right.
Herman and Wallace is the certifying organization. So if you go to the Herman and Wallace website, you can search by zip code and you can find a pelvic floor PT in your area.
Hmm. Hmm. Good.
So we talk a little bit about the anatomy, the physiology. Obviously, there's a mind-body connection that forms when you start to experience these issues regarding the lack of sensation and or anorgasmia or the inability to climax. Let's, can we spend a little
Yeah,
bit of time on that? Because that may also
sure.
be it's a vicious cycle, right? It hurts. I'm not enjoying myself. I don't want to do
That's
this
right.
anymore.
And it's one that for many women is inescapable, and they're resigned to the fact that I'm never, ever going to orgasm again, or I never have. There are a percentage of women who simply never have. And I'd love to share some resources for those women. But before that, I want to remind listeners that a sexual response is a biopsychosocial response. It requires biology, it requires um, the social awareness of being in the moment with a partner, but it also requires a sort of psychological acceptance and willingness and calmness and clarity and focus. And sometimes the psychological roadblocks are bigger than the physical ones. In other words, we can rehabilitate the pelvic floor. We can regenerate collagen. We can regenerate blood flow and restore blood flow with CO2 lasers or vaginal estrogen and other products. But if you're not in the moment because you're distracted because of a work problem or a health problem or a aging parent or a struggling child or a partner who's lost their job, if you can't be in the moment, it's very hard to have a normal sexual response. And I think things, if you're really struggling, like cognitive behavioral therapy, can be really helpful. I think mindfulness training can be really helpful. The founder of mindfulness-based meditation is John Kabat-Zinn, JONKABAT-ZINN. And John Kabat-Zinn does wonderful mindfulness exercises about being in the moment. Like with many other forms of therapy, you just have to accept that it can help you. You don't have to be ashamed about it. You just have to be willing to give yourself over to learning about it, because you have to have self acceptance, radically, really, to have full sexual experience, to have a total immersion in your sexual experience. It sounds woo woo and corny, but I'm not saying you need yoga, chimes or bowls or, a Zen master. I'm saying you need to be able to, even if it's just as you climb in bed at night, take a few minutes and do like a 5-minute visualization exercise. For some people, it's being in Italy. For other people, it's the mountains. For me, it's the Aegean Sea. When I can visualize myself in that clear, beautiful water in Greece, everything else seeps away, and I can really put things out of my mind. So listeners have to find that for themselves and be able to do it. I know that sounds a little corny,
No,
but
not at
you
all.
need to.
Not at all.
What are you
I'm thinking
thinking,
about
Jerry? Where's
Tuscany.
your place?
I'm thinking
Uh,
Tuscany, the
yeah.
Di Marme. So it's right in the
Oh,
most beautiful
oh.
place, and I think it's the most beautiful place in Tuscany. It's you see the mountains in the background and the seashore.
And
So
the sea. Yeah,
gorgeous,
beautiful,
absolutely gorgeous. But I
beautiful.
go there every night. Ha ha.
Oh, I want to hear more.
Yeah, I go
No,
there every night.
I think give yourself grace too, is what I would tell people. Okay, every night, I'm picking up on what you said, may not be possible for everyone. And that's okay. If you're having a bad night, you're having a bad night. You can give into it. You could make a list, get a piece of paper and write down the 18 things that are just keeping you awake. It's okay. But you don't want that to be your norm. And even if it just means taking your phone out of your bedroom, which is really the most toxic thing we have in our digital life, take that out of the bedroom. Do you know that 35%, I don't quote me, could be the wrong percentage, I believe, of couples check their cell phones immediately after sex, and 10% check while they're having sex. So I think our
That
digital addiction,
oh,
is
it's sad.
harming our ability to be in the moment, and it's probably underreported. Probably people didn't even
Probably,
want to admit it. So we
probably.
can do better by just setting our bedrooms up for success, I think. Yeah.
So in the chapter, and we're gonna leave you with this as your aperitif, right? This
Hmm.
is not the full chapter. This is just the
A
antipasto or
teaser. Yeah.
yeah, the antipasto. Let's call it that antipasto, which means your appetizer for the rest of the book and the chapter. You talk about a toolkit, and there are
Hmm.
lots of different tools that you recommend. So I'm going
Hmm.
to leave you, our listeners and viewers, with this. Positively Sexy is a book that is coming soon. Dr. Maria Sophocles is one of our chapter authors, an expert, as you can tell, in many of these matters. She's also written The Bedroom Gap. You can check out the podcast where she shares more information on the bedroom gap. But stay tuned for more on Positively Sexy and the bedroom gap. And as I said, this is just the antipasto.
Yeah. The tip of the iceberg.
That's right. Thank you,
Thanks,
Dr.
Cherry.
Maria Sophocles. This has been a pleasure to have you on the Love Mia Vita podcast. And to all of those who have tuned in, remember to love Mia Vita.
I love it. Thanks, Cherry.
Thank you. Thank you for joining us on the Love Mia Vita podcast. Love Mia Vita means love my life, and that is a mantra we should all live by. Please like and subscribe wherever you get your podcasts, and remember to follow us on social media and on fempharma.com. Thank you and be well.